And good afternoon. It is almost 5 o'clock. Quitting time. We better get the surgery done quick. I'm Dr. Deuk Majan. We're at Duke's Spine Institute Surgery Center, Viera. It is July 2nd, 2024. Our patient travels here from Virginia to Melbourne, Florida for the Deuk laser disc repair to fix a painful disc at L4-5, as well as facet joints that hurt and a piriformis muscle that hurts, that he's torn. We're going to get started. Dr. B, you ready? We're going to start with the Deuk laser disc repair. Num num? The first step of the surgery is to access or get to the herniation and tear in the back of the disc. To do that, we put some numbing medicine and make the patient more comfortable with a little anesthetic, numbing medicine, while I get into the disc itself. You can see the disc at 4-5. Jordan, show us our target. Shot. Right there, right where the tip of the needle is. Except I am not. I like to hit the facet. That's the facet, by the way. And then enter the foramen. Shot. Shot. I will tell you this, his spine is posterior, very far back, which means I need to aim a little further back to make sure I get to the right spot. Now you see that drop of blood? That's going to be the only blood we lose pretty much the whole surgery. All right, we're just about to the herniated disc. How are we doing, Dr. B? Are we ready for the patient to help us a little bit?
How are you doing, my friend? You okay? How are you? Okay, don't move. We're going to ask you some questions. Don't move.
How long has he had back pain for?
4 years.
4 years. Oh. He's had lower back pain for 4 years. And when I looked at his MRI, everything looked pretty good except he had a small tear at L4-5 in the annulus. Call it an annular tear. He also has pain in his buttock, piriformis pain. For those of you who don't know, the piriformis muscle runs from the sacrum, which is a bone, over to the hip. It's a fan-shaped muscle, just like that, and it attaches to the greater trochanter. We're going to release that muscle today to get rid of his piriformis pain. We're also treating his facet joints on the left side. He's got 2 joints that are painful because he's had injuries to them. He's got inflammation. How much time do you need? You awake?
You okay, my friend? We're going to ask you some questions, all right?
All right. How bad is that on a scale of 1 to 10?
Give us a number. 1 to 10. What'd you say? A 6?
All right. Is that where you get your pain? All right, we can go ahead and put him to sleep. He has a very small tear. It's actually tracking right along the needle. So this should be, as far as the DLDR goes, very quick. We're not going to have a big tear to deal with, and then we're going to get on to the facet joints and the piriformis. Yeah, shot. The dye we use binds to degenerated nucleus pulposus, which was only found in a herniated disc. Henry, let's show our audience, how is it that these disc tears and herniations cause so much back pain? What's the mechanism?
Disc injuries start with an annular tear, damaged nucleus. Pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals.
Welcome back. Did we finally get the tubes? The cervical.
Yeah.
Okay. You can see from our video that the tear causes pain because of inflammation. When I looked at his MRI, I noticed he had a very small tear. And that's all it takes, folks, is a small tear. We're going to go and debride the tear. And again, because this tear is so small, it's not going to take a lot of time like some people's discs, which take much longer because they have a bigger tear, more herniation. That's it. Perfect. There's actually a good amount of pressure going on in that disc. We're going to do this DLDR, then we're going to fix the facets, and then we're going to do his piriformis muscle. Because he has 1, 2, 3, 4 causes of back pain. By the way, 4 is the average. If you look at how many causes of back pain people come here with, 4 is the average. Look at that. There it is. That is nucleus pulposus. Under pressure, totally swollen. Nice. Look at that thing herniating out. And it's staining blue because it's degenerated, okay? This is not an old injury. This is a new injury. This is an example of a herniated disc that's young, not like 20, 30 years old like many of our patients. This is a fresh herniation. And look at that. A little bit of scar tissue, a little calcium there. That's from, because it's 4 years old, that's from the original injury 4 years ago when it started. Oh, yeah, very nice. Look how the laser just vaporizes most of the blue stuff very quickly. Not like those old herniations that have been around. Now he had a partial healing of the tear because when we did the discogram, you didn't see a big giant tear, did you? You saw a small skinny tear right along, tracking along the needle track. Because we hit a bullseye, but also because the tear is small. None of this is normal here. I don't remember how this patient injured his disc, or his back, I should say, but anybody know how he hurt himself? I see. He just started 4 years ago? Nah. So he probably injured himself even before 4 years ago. And then he got the painful herniation 4 years ago. The herniation that caused inflammation. Any questions from our audience?
At this moment, no current questions.
Let's show the audience, because this is going to be over quick in about a few minutes. Let's show the audience 30 causes of chronic back pain. I'm Dr. R. Deuk with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk Majan. Thanks for joining us. Is that?
Green light's on.
Oh, we're back. I just hear it. It connected for a second and then just disconnected.
You want me to grab it again?
Yeah. Just take it out of there and hold. One shot. Shot. Henry, can you hear me?
Yes, sir. Now I can hear you.
Yeah, there's a problem with the
Yeah,
Shot.
I got to look into this because I'm like, I never had this happen to me before, so this is definitely first. I'm looking into it right when we're done.
The antenna's loose.
On which one?
This part is loose. Holding it.
Can you hear me?
Yes, sir.
All right, we're done with the facets. Let's show the incision for the Deuk plasma rhizotomy, and let's end the broadcast. So, incision is just a few millimeters. You guys see that?
Yes, we can.
4 millimeters to be exact. So go ahead and end the broadcast. We're done treating his facets and his disc.
Copy that.